I'm going to talk you through a systems approach to physical activity and why it's relevant. And I'd like to acknowledge my colleagues Bill Bellew and Tracy Now that works in this space with me at Sydney University and through the Australian Prevention Partnership and through the Obesity Collective. Systems approaches are not really all that new. I've been around quite a long time in the prevention space, and we've in fact been talking about things similar to systems through the Ottawa Charter, through the Health in All Policies idea, and even through the more recent Sustainable Development Goals. The values of systems thinking are seeing the world in terms of the whole and its elements and their interrelationships, and that these methods will help us to change behavior of systems and behavior of populations through that process. Traditional research generated evidence in small-scale interventions in small parts of a system in which complex behaviors occur, and systems thinking takes all these interactions into account. Systems thinking also looks beyond the health sector at the environment, society, our social norms, our economic state, our culture that influence what we do, what we think, and eventually influence obesity. I'm going to talk about bicycles. I like talking about bicycles, and a bicycle is a system made up of several parts, but if you take any part, it's not really functional. If you put the parts together and put a rider onto the bicycle, the system then moves and conveys the rider from A to B and can only be ridden when the parts work together. Talk to any cyclist about a chain malfunction or a flat tire and the system doesn't work. Systems are dynamic, they're not static. The problems that we're trying to solve are complex and not static and non-linear. System describes this landscape, identifies the levers that we can use that are legislative or policies or organizational or environmental from which we can build solutions. Working with systems is useful for dealing with wicked problems that are difficult to influence, that require local engagement, flexible delivery of multiple interventions, and reflective practice. You can't just do one thing. You can't avoid local distributed decision-making, but you can support it and leverage it within a system. In 2007, the obesity systems map of the Foresight report in the United Kingdom actually started to map the first system for obesity and map the different components that contributed to, in the middle here, energy imbalance that was the fundamental root cause of obesity. And there are physical activity components to this, and there are individual level factors and food production factors. And I'm going to be talking about the physical activity side of this in particular today. When we think about the Foresight map and its relevance for obesity, it allows us to set physical activity goals. It shows the intersection of directions for improvement that we need and what kind of decisions we need, what partnerships we need, and how we can assess implementation and progress. The World Health Organization has determined a 10% reduction in obesity by 2025 and a 15% reduction in inactivity by 2030. In addition, in 2018, WHO launched the Global Action Plan on Physical Activity. And the Global Action Plan has 4 major premises: create active societies, create active environments, create active people, provide programs and opportunities, and work within a system. So system became mainstream in 2018 in thinking about physical activity. And the model that we drew for the Global Action Plan looks like a systems model. It's got the 4 dimensions that I described before, but each of their determinants and interactions and mutual interactions. These pathways are not unidirectional. They are mutually related to each other, And if you influence one, you can influence several things that contribute to a more active society. The International Society for Physical Activity and Health last week launched its 8 best investments to increase physical activity: school programs, active travel, urban design, healthcare, public education, sport, workplace and community programs. And these things summate to a functional system. It's the same way of thinking about it. So in our work in the Australian Systems Approach to Physical Activity, Project ASAPA, which I share with Bill Bellew and Tracy Now and Ben Smith, we take a systems approach because physical activity lends itself to that. We've done a lot of mapping of the physical activity landscape in Australia. We think systems can help facilitate physical activity strategies. And also we've done it for physical activity beyond just obesity, because there are a plethora of co-benefits of physical activity, some unique to physical activity. A simple example is if we get more people actively commuting, taking active modes of travel to get from place to place, we'll have less car travel and less air pollution and improved air quality. So we've got a co-benefit with air quality and therefore with climate change that is, with air quality, is unique to physical activity more than, for example, tobacco smoking, alcohol, or healthy diet. So our way of framing it is we're dealing with a long-term problem. Our rates of physical activity have been fairly flat for 25 years, monitored through the National Health Survey. We've got multiple issues causing physical inactivity, and we've got to address that in the systems approach. We've got competing interests and even more complex competing sectors, not just the health sector. And we've got the issue of numerous co-benefits. And that leads us to take a systems approach. So twice we've drawn systems models for physical activity. And this systems model is one that we presented as an extension of the WHO model, which has active recreation or play, walking for transport, cycling for transport, and sport, and all of their determinants around public transport infrastructure, cycling infrastructure, driving behavior, sport facilities, proximity to destinations, urban design, climate, air quality. So as you move further out, you're moving upstream, and you need to consider all of these upstream kinds of issues in thinking about how you're going to take physical activity seriously and comprehensively. It's no good doing one randomized controlled trial on one issue like family commitments, which will be over here, which eventually leads to recreational play. You may show that works, but unless you're dealing with all the other elements in the system eventually, you're not going to get to making population level change, which is, I think, where we're all heading in this space. So we've done some national mapping of physical activity through this project. And we've developed a document called Getting Australia Active 3, which builds on work that Bill Bellew and I did in 1998 and about 2004, respectively, the 2 earlier editions of Getting Australia Active, which is a policymaker's guide to physical activity and provides not only settings-based approaches, but whole of systems approaches and policy domains. What are the different policy levers that are needed at a system? And how will a system address inequalities and inequity for activating the inactive, not just providing programs to those who are already active or already motivated to be active or living in activity-friendly environments. Building systems thinking is using systems methods to describe the problem, analyze the problem, and develop solutions. It's a little bit different. It's thinking differently about programs and policies than about individual change as your only focus. And in this way, systems thinking is cognate between healthy food policy, healthy physical activity, systems approaches to reducing smoking, systems approaches to alcohol control, to gambling, to climate change, to any of the other major public health issues, and several of those linking together to obesity prevention so relevant to the collective. You need to understand the sitting. Where are the leverage points that are the best places to intervene? What needs to be measured to understand the observed effects? And measurement is both qualitative and quantitative. And how can you explain what you see? And again, evaluation is mixed methods, qualitative and quantitative. You sometimes need to do network analysis to look at how people connect. Where are the leverage points in dealing with the transport department, the Parks and Rec department, the local municipal councils, and the health sector, education sector, the sports sector, in linking them together? Where are the leverage points in that network to make physical activity progress that's relevant to both? Because the transport department has no physical activity goal, but it does have a goal to get more people onto public transport, which is a common goal. So the number of bus tickets sold, the number of people traveling by public transport instead of private transport means there's more active commuting getting to and from that. So you need to decide who are the partners, who are the organizations that can participate in your system. You need to analyze what the context is and what change might be possible. It's more than just, let's give more dose to an intervention, because a system is interactive and dynamic. You need to identify where knowledge is and where resources exist, and how you can co-locate resources to actually make more of the resources that you have. You need to think in long time frames, measure at multiple levels. You don't abandon randomized controlled trials, but they're only a small part of the puzzle, because systems need flexible and adapted interventions. And sometimes you can take what you learn in controlled studies and standardize them, but you may have to change them substantially and be aware that they change in different contexts and different environments. You've got to follow the interrelationships, the multiple perspectives of different stakeholders, and understand the boundaries around what you can do and what you can't do, what the system will let you do, and where the system is going to be more difficult to shift the linkages. You measure at multiple levels, and this cartoon describes everything I can say about evaluation. Which methods should we consider? And the answer for systems approaches is all of them, always. I'll give you a few examples to wind up of actual systems approaches, and most of them have been developed in the UK, where systems thinking has worked at the local municipality and local county regional level very well. A good example is Sheffield, to become UK's most active city, doing things differently, building from the grassroots up, reducing inequalities, an inclusive approach, connecting people with their environments and their opportunities, making physical activity the easy choice, having communications and a logo and a brand that are consistent, and working across agencies within Sheffield. That's an example of a systems approach. Another example is in South Tyneside in the northeast of England, where they got the local council workers in all the different agencies in the council together and drew a systems map on yellow sticky paper, on butcher's paper, on large whiteboards, and drew a systems map about what each group, each sector, subsector thought was relevant. So the stakeholders built the systems map, and for South Tyneside, it might be different to building one for Sheffield or London or somewhere else. So this is a locally built, grassroots built phenomenon, understanding the local linkages and the local resources, and then building the interventions around the key points that those resources function in that particular environment. Then they develop a plan, and this is taking the systems map and developing a logic model, a planning framework. And this is just a piece of the planning framework that's called the planning and the environment, which embeds it in the local municipal plan, considering to develop cycling and walking strategies in future urban planning deliveries, developing the processes of how each agency can contribute within the borough, linking to a healthy place initiative. And this is built across the entire plan. This is just a tiny piece of it to show you how this thing kind of works. Another one is evaluating Gloucestershire moves, which is another systems approach. And I'll show you what the research team is doing. This is the research team from the university in Bristol, which is understanding how this initiative influences the factors which cause inactivity. And this is evaluation of a different kind. It's not doing controlled trial and putting accelerometers on people. It's analyzing professional networks across Gloucestershire to see how they're working together. So it's analyzing partnership formation and partnership development. It's systems mapping to understand the factors that influence physical activity, back to the yellow sticky notice board, back to the butcher's paper. It's interviewing and understanding stakeholders and community members, and it's understanding large population data sets, large routine population surveillance data sets to understand if there are any features, population subgroups that are different in Gloucestershire. So that's really what I wanted to describe in thinking about systems approaches. And you can never suddenly develop an entire systems approach in a community or a municipality or a state or a country. So it's towards a partial system solution. It's thinking in a systems-focused way about physical activity. When you're implementing any single component or program, what might it be connected to? It's working on parts of the system together because it's almost impossible to resource the whole system being implemented at the same time. So it's an iterative process. And it's a concept of a shared agenda of co-creation with your stakeholders, with your agencies to address problems together. And the planning occurs with each of those components in the system. So really in physical activity, we haven't been really successful in changing the needle of increasing physical activity, improving the dial. We've been doing the same things again and again. We've been repeating the same mistakes again and again over time. And really what we said in the Lancet Physical Activity series in 2012 is more of the same is not enough. And systems approaches is one of the main ways that we're finally beginning to drive that statement into reality.